Good afternoon. Thank you all for being here. Excuse me, I, along with all of my fellow Alabamians, have been monitoring closely the rapidly changing development of the coronavirus in our state. As a state, we have taken preliminary measures and made preparations in the case that this virus would eventually reach our state. Our first case of confirmed case was announced earlier today. As I've emphasized time and time again, the safety and health of all Alabamians is paramount. A short time ago, we heard from President Trump, who officially declared a national emergency amidst this outbreak. And this declaration will certainly help us states around the country continue to work to mitigate this virus. In Alabama, we want to work in conjunction with these efforts, and to that end, I am now issuing a state of emergency for our state of Alabama. The state of emergency will strengthen our efforts and plans already in place, helping to alleviate our health care facilities and providers, our schools, and in turn, citizens across our state. Additionally, effective Wednesday, March 18th, at the close of business, all public K-12 schools across the state will have a 2.5-week break. This is in order to reduce the risk for students, teachers, and others from potentially being exposed to the virus. Folks, let's take a common sense approach and remember that calm and steady win the race. Alabamians should not be fearful, but instead use common sense to watch out for ourselves and for others. We will remain engaged and continue to closely monitor the situation to help keep Alabamians informed on all of the facts. The safety and well-being of our citizens is of the utmost importance. Again, I appreciate the hard work of our State Health Officer, Dr. Scott Harris, State Superintendent Dr. Eric Mackey, Alabama EMA Director Brian Hastings, members of my task force, and countless others. We will handle this situation together. Now I'll turn the program over to Dr. Harris.
Thank you very much, Governor Ivey. Thank you. I'm Scott Harris. I'm the State Health Officer. We appreciate you joining us this afternoon. Thank you to Governor Ivey for your leadership on this issue. I've spoken to you a few times from this position over the past few days, and we are grateful that the governor has decided to declare this state of public health emergency. We think that's exactly the right response, and that will help us so much in our ability to carry out our public health functions and make sure that we're protecting the health and safety of all Alabamians. I have some additional information to let you know about that we have just learned about in the past few minutes. We had a second confirmed case of the coronavirus that we were just notified of less than 30 minutes ago. This was from a person residing in Jefferson County. That patient and that patient's physician have already been notified of that. This is a person who has been isolating at home because of illness. Jefferson County Health Department is involved with that process, as are ADPH staff who will be a part of that investigation as well. I would say that this is a very fast-moving situation. We're not surprised to have additional cases, and we have been expecting this for some time. I would say that also that in the past 5 to 10 minutes, just as we were preparing for this press conference, we have some preliminary reports of 3 additional cases, so that would bring us to a total of 5. I don't have full information on that at this time about those locations, but we'll try to provide that for you as soon as possible. Again, this is something that we have been expecting. We have known that we probably had disease transmission in our state, but as we have ramped up our testing capacity, we are starting to find these cases just like surrounding states have had. We have a number of responses that I've talked to you quite a bit over the past few days. One additional thing I'd like to let Alabamians know about tonight is we have a call center that will be established starting at 8 a.m. Tomorrow to answer questions and help people who are concerned about whether they are need testing to call and get information on how they could obtain that. This is not a medical information call line to talk to a physician or to get a diagnosis, but rather it's a call line that will give you information about how you might be tested depending on where you live and whether you have a doctor. The number for people to call starting tomorrow is 1-888-264-2256. I'll repeat that, 1-888-264-2256. This is a toll-free hotline for people to call if they have questions about whether they need to seek testing. This will put them in touch with their own provider if they have one, or try to connect them to another provider who can help them make a decision about that if they do not have a provider relationship already. Again, that will go live tomorrow morning at 8 a.m. I'm sure there will be many people called because many people are concerned about this, so continue to call. We'll increase capacity on that hotline as needed, and so that way everyone will have an opportunity to call and reach someone and speak to a person about that. That's all the new additional information I have at this time. We'll take questions in a few minutes if you have additional questions, but at this time I'd like to turn the podium over to Dr. Eric Mackey.
Thank you, Dr. Harris, and certainly thank you, Governor, for being proactive. We were very fortunate that the Governor called a task force together several days ago and got way ahead of this before we even had one confirmed case in the state. So we're able to react very quickly as new cases are confirmed. We're also fortunate that she's been very proactive to go ahead and make a decision about what to do with our schools. As the Governor said, we'll be closing school at the end of business on Wednesday. That gives parents 3 days extra to begin working on and thinking about child care. We didn't want to do something that was too quick because we know that parents need some time to make those decisions for their children. But we will close on Wednesday. We will be closed the 2 weeks following that, and then we will make a decision working with public health and with the Governor and her task force during that 3rd week about what we need to do going forward. We will not wait until the last minute. Obviously, things are changing very fast, but we want to give, as we make changes then and make decisions about what we have to do after that last week of the closure, we'll make that decision as quickly as we can based on the information that's available that week. I'm going to also turn it, I think we're going to have questions now. Dr. Harris is going to moderate the questions.
Thank you, Dr. Mackey. Questions? Yes, Lydia.
Yes. Is there a second case in Montgomery Baptist put out a press release saying a person in their hospital has it?
I do not know of a second case in Montgomery County so far. I know of one that is in Montgomery, one that is in Jefferson. We did have a report of these 3 others that I just learned about and have very preliminary information about. I don't know where they are located. I think our staff has that information. I honestly just haven't been briefed because we were walking into the room when those reports came through.
You said earlier that the state started testing in-state last week. Following that, do you expect more cases to come out?
I think that's very likely given what we've seen around the country. When we first rolled out our testing, if you remember nationally, all of those tests had to be sent to CDC. It was a slow process and difficult to get tests done because there just wasn't enough capacity initially. Now that states have begun testing, almost all states were testing by the end of this past week. We are beginning to identify cases, which is exactly what other countries have seen around the world. So it's not surprising at all that we've seen more cases.
What more can you tell us about the case up in Jefferson County?
The information I have is that this is a person who traveled internationally and returned to the United States and was ill about the time of returning. That person saw their own personal physician who requested a test. That test was performed, and those results were received by us just about 30 minutes ago.
Can you tell us the age range of this person?
I don't have that information.
Dr. Mackey, can you tell me, will this impact private schools as well?
This will not impact private schools. This is just for our public K-12 schools.
And then looking at the proclamation, if there's some wording about days, will the schools not have to make up these days within the year?
That's correct. So under a state of emergency, there's a provision in the law that we can forgive those days, and that's our intention right now. Well, that is what's going to happen with these days. So for the days that are closed, that's a total of 12 days. They will not have to make those days up. I do want to say this too, though, on that, the purpose of this is to give the virus more time to hopefully mitigate the spread of this disease. And so even though we're closing for 2.5 weeks, we want students to be very cautious, not to congregate in large groups. They need to take this seriously. Families need to take it seriously, and as much as possible, stay isolated, even though they may not be symptomatic. But we don't need large groups of people congregating together. We had put out guidance earlier today, canceling school events and some athletic events and other things where people would be congregating together in large numbers, and those are still in effect, and those directives actually go through the end of April. So we still want to make sure that people continue to self-isolate, that they continue to take care of themselves. All the things we've said about washing hands, about covering coughs, all those things still count, because even though schools closed, this is our opportunity to hopefully slow down the spread of the virus.
What factors are you going to look at when determining whether or not to expand the closure for another week or whatever the case may be?
Sure.
What are those factors that are going to determine that?
Well, obviously, between now and then, we'll be working closely with public health. We'll be looking at, is there an outbreak? Does this continue to grow? And if so, is it sporadic around the state, or is it statewide? Are there communities that are more heavily affected than other communities? Those are the kinds of things we'll look at. We also will be looking at how it affects our school communities. So one of the things, we'll be sending guidance out to superintendents this evening. One of the things we're going to be asking them is to continue to report to us, as we had asked them before, if there are students or staff or family members who have confirmations of COVID-19, because we want to continue to monitor that on a daily basis. That'll go into our decision about what we need to do as we approach the end of the month.
For our viewers that may be just tuning in, can you repeat the days that schools will close and open?
Yes, school will close next Wednesday. I think that's the 18th of March. I got my day right. And then we'll reopen. So at the end of the day, on the 18th, we will close, and we will remain closed for 2 full weeks after that, with a target of reopening on April the 6th, Monday, April 6th. And I want to emphasize that as a target. We will reassess during the last week of March what's going on, working with public health, and make a decision during the last week of March as to what needs to happen next. But that would be our goal for now.
How are school athletics impacted?
School athletics there will be no participation, no athletic events during this time.
Are districts expected to provide virtual learning in any aspect of the time?
No, this school will be closed. We do have, I know that we have some schools that are going to be sending home projects. I'm sure that between now and Wednesday, again, that's another reason to give us some time to ramp this up. So teachers may want to send some reading projects home. They may want to send home some electronic projects, but it will not be an E-day. School will be closed during those 2.5 weeks.
What services is the Department of Education going to provide when it comes to food and these other services that a lot of students receive inside the school?
Sure, excellent question. We are already in the process. Again, the governor's been very proactive, and so we have already worked with the United States Department of Agriculture on a waiver. The USDA is willing to give a waiver to states for communities that have high poverty, which is 50% of their students, 50% or more of the students that qualify for free reduced lunches. In those schools that are high poverty, we can continue to prepare meals for students who qualify for free or reduced lunches. We are working with districts now on that. I want to emphasize we have the waiver in process. We know for sure the waiver will be approved. We have no reason to doubt that. But that does not make it easy to get the meals to students. So just because we can prepare the meals, obviously we have distribution problems. We have been working on that this afternoon with our staff. In some cases, families may come to the school and pick meals up. In other cases, we may use some community volunteers to deliver meals. We obviously are also going to follow health department regulations. So if they're hot meals, we can't take hot meals out unless we have the proper way to transport them. But we have actually been working on that all day today. Our staff's been on that, and so we're communicating with local superintendents on that. Some communities may not have the capacity to do that, to deliver the meals, but on a case-by-case basis, as much as possible, we will continue food service.
Do you anticipate when you'll be able to start providing that food service?
No, I don't have a good answer for that right now.
Do the closings apply to the state's pre-kindergarten program?
If it's a pre-K class that's in one of our public schools, yes, it does. And I don't know about the other pre-K classrooms. I would imagine we've actually had communication today with several private schools around the state because many of them follow the public school schedule. Many of them have said they want to follow what we do in the public schools, but I'm not prepared to say like each one what decision they would have made. But if 70% of our first-class pre-K classes are in a public school, and all of those will be closed. Anyone else?
We have additional questions?
You know, for people who, and I kind of asked this earlier, but you know, people are going to the stores. Some people are afraid to go out in public. I talked with some friends who said they're afraid to go to restaurants. They don't know who has it. That's part of the concern here. Should people be concerned? I mean, we're closing down schools, and that automatically puts an element of panic into the room. I mean, what's your message to people?
Sure. I think we recognize that people are concerned, and when hearing about an outbreak going on in other states, it certainly makes people anxious. That's a perfectly normal way to feel, and we understand that. And yet we think we have a good plan in place to handle this and to mitigate the spread of this disease. I think closing the schools is a terrific idea, and out of an abundance of caution, it's a great way to limit transmission in the communities. And at the same time, we don't actually have cases that we're aware of in our schools, but yet it's a great proactive step to slow the speed of transmission in the community. What I would tell people is similar to what we talked about yesterday. Please use your normal prudence. Be smart about hygiene. Be smart about covering your cough, about washing your hands. Please stay home if you're sick. If there's a chance that you could be ill, we would want you to stay home and try to contact your provider and minimize the chance of spreading that to someone else. For those people who are particularly vulnerable, people like the elderly, people that have certain chronic health problems, I think those people in particular need to be prudent about being in large groups of people where they could be exposed to someone with an illness without even realizing it. The guidance that we gave yesterday was a recommendation to avoid mass gatherings, and we define that as 500 people or more. And of course, any number you choose is going to be somewhat arbitrary in a way. Really more important than what the actual number is to ask the question, can you maintain a safe distance between people to minimize the spread of disease? And from what we know about coronavirus, there seems to be something about a 6-foot range that's important in the transmission of that disease. So being within 6 feet of someone who's ill and for a prolonged period is how this disease tends to spread. So it's really much more important to try to minimize the spread by observing that rule. So our recommendation would be to avoid any type of crowding situation where you couldn't maintain that 6-foot rule. And you know, if you're going to be in a space for a prolonged period of time, more so than an actual number. I don't think people need to be frightened at all. I think that they need to use normal prudence, and I think together we will be able to get through this. We know that in other spreads of outbreaks, there's a defined period of time, and that the time is not exactly known right now, but we know that as we continue to work on this, at some point we'll get through this.
Is there any concern with kids being out of school, that their parents may be some sort of medical personnel, EMTs, whatever, and they may not be able to go to work because their kids are out?
Sure. Dr. Mackey may be able to address that even better than me, but obviously there are a lot of considerations that go into a decision about closing schools. Certainly parents who are directly responsible for caring for those kids may have to make changes, and so obviously there are effects on workforce when kids all have to stay home. And when you look at all those things on balance, I do feel that this was the right decision about closing schools, but certainly we have to be aware of that fact as well.
I know you don't have a crystal ball, but where do you hope we'll be a month from now?
I would hope that I will say, first of all, we probably expect to continue seeing cases as we continue to ramp up our testing capacity. More cases will come in. I would hope that a month from now we'll be seeing less cases or seeing new cases at a slower rate. But the fact is, it's just too soon to say right now. This is a new virus. We don't really know what the activity of the virus is going to be and how long things are going to continue. We can get some messages from looking at other parts of the world. We can't exactly correlate what happens in this country with China, for example, but in China you can see that they had pretty significant activity for about 3 months, and things have slowed there significantly in the past few weeks. So it's possible that it could be similar here, but we just don't know right now.
Governor Ivey, how confident should the people of Alabama be? You're leading the charge in this, but how confident should the people of Alabama be in that the state has a handle on coronavirus?
Well, the people of Alabama can trust the members of the study commission that I have supporting this effort, certainly Dr. Harris, Dr. Mackey, and we're being very thorough. And I think the people of Alabama trust us when we say we are being very thorough. And this is an ever-changing situation. The virus is unknown, so we are ever-changing, but we're nimble, and we will face these challenges as they come.
Governor, are you concerned for the economy at all? We've seen some stores, kind of close down. People say they're not going to go out to eat as much. Is there any concern there?
Well, there's no question that this whole thing is slowing down activity and travels and tourism and whatever, so there's no doubt that it's affecting it. But I was pleased to see the stock market started going back up today after the president started his press conference announcing a national state of emergency.
If I understood it right, the emergency order means that the schools won't have to make up the days. Is there any other significance to the emergency order? Is it?
Well, the emergency order for the state is very fluid and very flexible. And, for example, as governor of the state of Alabama, I could say all state employees are not coming to work, but we're not doing that. We want all state employees to continue to come to work. But the state of emergency gives the governor broad and flexible powers, and we'll use what we need to in the most prudent manner possible.
You've got 2 weeks with kids going to be out of school. It's nice weather right now. Parents are going to have to be dealing with some kids that are wanting to get out and go do something. What do you suggest parents and families do with this nice weather, but they can't get out and actually be out in big audiences and stuff?
Well, maybe they can find a swimming pool somewhere.
Okay, yeah.
Thank y'all.
Thank you very much. Thank you very much. We appreciate you being here today. Thanks so much.